Perceive, process, perform. Do you need inspiration for your practice, or do you simply need to practice inspiration? With this series, we aim to do both. Give us 15 minutes and we'll give you practice inspiration.
Hi, I'm Lisa Copeland, CEO of Lisa Copeland Communications, and I'm here to give you a practice inspiration for today. We're going to be talking about Ironman communications, the principles of Ironman communication. And what that looks like, you're probably thinking, well, what the heck does an Ironman have to do with business communication? Here's how it works for you and for I. In 2005, I participated in my very first Ironman. I stood on the front lines, as you can see in that picture. I'm that little tiny white cap in the very front row of 2,000 people. And I was about to partake in the first part of the Ironman, which is a swim. Now that's my best event. Before I got to that day, I'd signed up a year in advance. And here's what I did to prepare. I hired a coach. I worked with a team. We came up with a customized preparation for me to be able to train and really execute and make it through that whole day. So by that preparation and the planning, that's what got me over the finish line. I thought about that after I finished the Ironman, and I thought, gosh, how does this apply to life? And what I came up with was the Ironman principles of business communication, because the same things I did that day translate into principles of business communication. So today what we're going to be talking about is the best practices for you utilizing communication. So how do you customize verbal skills for your team and then differently for your patient? Also, how to be prepared, because we know that things don't always go as we plan. I've been in dentistry for 30 years, and sometimes it looks great on paper, and it just doesn't work out that way. And then also, how do we continually adapt? If you're prepared and you've got great plan in place, the way that you adapt won't have to be so severe. So we're going to break the word down, Ironman, into an acronym. The I in Ironman stands for impression. So the impression that your team makes on the patient, as well as the impression that you make on each other. So how do you show up for the day? Do you collaborate? Do you have fun? Do you communicate? Are you giddy with each other? Are you sharing stories about your weekend? Or does everybody work in a silo? Right? Patients know and see much more than we ever anticipate. And so what's the impression that you're leaving on them? The second part of impression is, what's the impression you're making on your patients, particularly if it's a new patient? Research out of New York University shows us, from Dr. Solomon, shows us that people evaluate us in 7 seconds. He calls it the 7-11 rule. In 7 seconds, people evaluate 11 things about you. That is amazing. We have a very, very short time to make a first impression, and that first impression is really going to last forever. The R in Ironman stands for relationships. And it's the relationships that you build with your team members and your patients that are going to be the basis or the foundation of how that patient moves through your practice and how your employees work together on a daily basis. And they're super important to establish right from the very beginning of your encounter. So think about it from a generational perspective. We're all immigrants to each other's generation. And so if you want to really fit into or present yourself as that generation is expecting you to, there's a couple things that you can do. If you look at the slide that I just had up on relationships, this is a dentist interacting with a senior patient. Now this patient falls into either the baby boomer or the traditionalist category. And this dentist was brilliant in the way that he adjusted his dress code for this particular patient. The tip for you today that you can apply both professionally and personally is dress to the oldest generation. So if you don't present yourself like this typically during the day, if you're wearing scrubs and you know you have a traditionalist or a baby boomer coming in, maybe have a white lab jacket that you throw on over your outfit. Take it a little one step further and put on a collared shirt, put on a tie. That is what that generation is expecting the dental professional to look like. That's what they've grown up with. And so if you can really meet their expectations, you're getting your relationship off to a really, really nice start. The O stands for opportunity. look around your office and see where there's opportunities for you to really improve. You might be at a very high level, and most of the Seattle Study Club offices that I've been in are at a very high level, but there's always room for improvement. There's always something you can do to take to the next level. Maybe it's the conversations that the receptionists or the admin people in your office are having on the phone. Write out a script or have scripts available so people are giving the same message. You don't have to follow the script to the letter, but at least have guidelines so that they're all getting the same message across to the patients they're encountering on the phone. Because sometimes that's your first impression that the patient has with your office. Also, look around your surroundings. When you walk into your reception area, look around as if you were the patient coming in there for the first time. What are some of the things that you could do to improve? Also think about the patients that you're trying to attract, because leveling up and really impacting the office and the appearance of the office that way is really going to help you attract that certain type of patient. The N stands for needs. You want to put your patient's needs secondary to the patient's wants. If we don't achieve what the patient wants by coming into our office, they're never going to follow through with what they need. We've got to be able to marry those two, meet the patient's wants first, and then move on to their needs. So on your health histories, for example, think about putting a question about aesthetics, an open-ended question, not just getting a yes or no answer. You want an open-ended question. One that I've always used in the practices I work in is, how would you like to change or improve your smile? And guess what two answers you're going to get? They're always aesthetically related. Whiter teeth, straighter teeth. And if those two answers are why the patient is coming into your office, you have to be prepared to discuss that before you go into clinical land and perio land and restorative land. You want to really first talk about why the patient's here, what they want to achieve by coming into your practice, and then move forward with what the patient really needs. M stands for management. We're going to focus on just two aspects of management today. Management from a fee perspective. Everyone in the office should be familiar with your fees. Not to have a full-on discussion in the clinical chair, but just so you can answer and relate to the patient from a fee perspective. The other aspect of that is you really should have a great understanding about how you can help your patients maximize the benefits that they have available. That is just going to elevate the relationships and really help the patient navigate through your office and the procedures that you're recommending with confidence. The other side of management is managing your team. And teams, the number one reason that people leave a workplace or a job is because they don't feel appreciated. And so set up some type of reward system. You can do it on a monthly basis or on a quarterly basis, some type of reward to recognize the employees that are going above and beyond with the patients, with the team, for the office, with the revenue. There's a lot of different things that we could be rewarding, but recognize people every single day for the great achievements they're accomplishing and contributing to your practice. A stands for action. Everybody wants to succeed, and everybody needs a call to action. So whether it's the patient that we're devising a treatment plan for, and maybe we referred them to a different office for a special procedure, give them an action plan and make sure you include the what, the who, and the when. The what means, what are we going to do next? Who are you going to see next? Who's going to be involved in that? And when are we going to accomplish that by? If you've had a team meeting, a huddle for example, and you've decided you're going to go in a direction for the increasing practice revenue, maybe in whitening, decide what you're going to do, who's going to be involved, and when you're going to achieve it by. It makes it a much more manageable and tangible execution of the idea. And it helps the patient to understand the processes and the procedures, because we speak our own language and very often the patients get confused. So make sure that it's very, very clear to them what we're going to be doing. The N stands for nurture. And nurturing your relationships, it's one of the best things we can do for our dental profession and also for the patients and the practice. If we nurture, we follow up, we follow up, we follow up, and I see office after office after office that fall short in follow-up. It is one of the best ways you can establish a better relationship with your patient. Think about if you've ever had a procedure done and the next day on the phone, the doctor calls and says, "Hey, how are you doing?" So if you have a procedure done in your office, have the person who did the procedure follow up with the patient. It will take your relationship miles ahead of most offices. The other side of nurturing is continually have touch points with your patients. So throughout the year, utilize social media to have touch points with your patients, right? If you send out a newsletter, an electronic newsletter, and make it a little bit personal. Don't have it all clinical. People love before and after pictures, right? We stand in the grocery store line and we look at all the before and afters and think, ooh, oh, ooh, right? And so think about before and after, but also the clinical side and the personal side. Involve your staff in the newsletter. If you have somebody that just had a baby and a lot of the patients know them, post their picture, post a picture of the new family, right? So make it a little personal, have a little bit of a curtain pulling back into your personal life as well. It makes the patient feel more connected to you. Also, under nurturing, make sure you're staying up on trends in dentistry. And again, the Seattle Study Club is miles ahead of many, many practices because you really do pay attention to the trends in dentistry. People are having world-class expectations that are sparked by social media. They know about you and they know about your reviews before they decide to come into your practice. And so pay attention to what's happening. What are the reviews occurring on your particular office? Dentistry, as you know, is very, very competitive, so pay attention to what people around you in your circle or your neighborhood are doing. And then also, people are expanding their in-house treatments. We are trying to keep the revenue within our practice and not refer out so much, which is a great thing, but make sure that your patients know about it because they could go somewhere else not knowing that you're providing those treatments now. So circling back to the Ironman, I started at 8 a.m. that day, and I did a 2.4-mile swim, a 112-mile bike ride, and I finished it off with a full marathon. I crossed that finish line, and they announce as you come over the finish line, they announce every single person, 2,000 people, they announce, you are an Ironman. And so I achieved that goal because of the planning and the preparation that I did before that day. On an annual basis, you look at your practice and you prepare for the next year and you plan out what you're going to do to achieve your goals. It's the same concept, training for an Ironman or training for your business plan. So my final question to you today is, what's your plan to become an Ironman communicator every single day? I'd like to thank the Seattle Study Club for this opportunity to bring you my dental inspiration.